In this video, we are going to see the how to write the record, that is medical surgical nursing. Okay, in that topic, I am going to discuss is physical examination. Okay, so in this, what all the just I will explain it in briefly. Okay, so let's get started. So first, the physical examination will be done by for the client who was admitted in the hospital. So first, you have to write the general points of the patient. So first is name of the patient, okay, educational status, whether the patient was educated or uneducated, and if he educated, till how many classes he was studied, that you have to mark it. Other, if it is not studied, means whether he is illiterate or uneducated. What's the difference between illiterate and uneducated? Means illiterate means the person who doesn't know how to write and read, that person will called illiterate. Uneducated means the person is able to write and read, but he won't go to the school, so that person will come under the uneducated. Okay, that's the difference. And date of admission, here you have to write IP number. IP number means inpatient number. Whichever the patient will admit in the hospital, they will have one IP number. So that number you have to write here. Then ward, which ward he was admitted, consultant doctor, then medical diagnosis. Diagnosis you have to write here. So that's about the general things, identification data. Okay, now we will see the appearance, general appearance. Okay, so level of conscious, with the help of a glaucoma scale, you have to know that the patient is active, lethargic, or stupor. Comatose means conscious or unconscious, semi-conscious, that you have to write here. Then activity, whether the patient is active, means anxious. Whatever you are asking, he is very alert to say all the answers. Otherwise, he is very lethargic. Okay, he was very calm and quiet. So what is that? So that activity you have to write. Body built means like weight of the bed, depends upon weight, whether the body of the patient is lean or moderate, obese, underweight. Okay, so that here you have to write. Then height until you have to write measurement with the help of a tape, and weight you have to mark it here. Okay, mid-arm circumference. Mid-arm circumference you have to write here. How you are going to take, if it is a shoulder, you have to first take the midway point. How you will going to measure in between the this shoulder point to elbow point. So that midway point you have to take. There you have to measure with the help of a this one tape. Okay, that is general grooming. General grooming means how the general appearance of the patient, means like hair, whether the patient is grooming or not, combing. Okay, dressing. General grooming ante hair, dressing, personal hygiene you have to take, even though the patient is not have a chance to take a bath, so that the patient is take the sponge bath and he will change the dresses. Okay, so like that. So whether he was dressing, personal. Here one more point is also there, hygiene and grooming. Hygiene and grooming means about the skin, mouth, nails, if the bad breath is coming or not, nails are trimmed or not, skin is neat and clean, it is moisturized. So that all we'll see in the hygiene and the grooming. Okay, here position and posturing means like whether the patient is how dynamic or static posture, means he's sitting alert like that, he's not leaning to the forward. Okay, lean kakunda, lumbar or thoracic. This thing also will say whether the patient is having kyphosis, lordosis. Okay, shape of the vertical bone, everything that we will write here. Then facial expressions, whether the patient is smiling, grooming, happy, depression, means mood. So here in the facial expressions we will see the mood of the patient. Body language. Body language means whether the patient is interested or not, how he is sitting. Okay, how he is sitting, whether with the folded hands or with the folded legs, or like that, like having the grimace face expression. So that all will come under the body language. Hygiene I have already told. Nutritional status, whether the patient is undernutrition or like we can say that malnourished. Okay, if you are seeing any malnourished symptoms, what are the malnourished symptoms? Means hair of the color will be different. Okay, nails will be different, whether the patient is looking anemic. okay, body build, that all will come under the, means depending on this condition, these symptoms, we will diagnosed, or we will see the status that the patient is malnourished or undernourished or well nourished, okay, that all. Other observations other than this, if you are finding any uh, abnormal things, that we will mark here. Okay, this is about the general appearance and the identification data. In the next class we will see the next video in head to foot examination. Okay, thank you.